This is an interesting case of a 51-year-old female who came in. She previously had cataract surgery on the left eye and developed a complication during surgery called intraoperative floppy iris syndrome. This syndrome is known to cause a poor pupillary dilation, intraoperative complications during cataract surgery. After the cataract was removed, she ended up with iris transillumination defects because she lost iris pigment during her surgery. Having holes in the iris like this can cause a lot of glare. The regular function of the iris is to block light from reaching the retina, and the iris will constrict or dilate depending on the amount of light, ambient light in the room or in the space, in order to protect the eye from glare, from light sensitivity. And so it's like a curtain. So in this case, you have a patient who has iris transillumination defects, which means that there's more light getting into the iris than the eye would plan for, which causes a lot of glare. And in this case, debilitating glare. This patient actually works in a ballet studio, which is full of windows and is just very, very miserable with the amount of light that she is seeing right now. What she came to us for was to help her design a prosthetic contact lens. And the prosthetic contact lens, we can put an opaque backside on the lens, which actually blocks light from coming through the pupil or through the iris. And we can make the hole or the prosthetic pupil as big or as small as we want in order to reduce the amount of light going inside the eye. When we put a prosthetic lens on this patient in the office, she immediately noticed an improvement in glare and was really excited. We also work with our color match specialist in order to find the right color that it can match with the other eye, and the patient can have also improved cosmesis, if any complaints. But in this case, obviously we want to match the color as best as we can so that it doesn't look like she's wearing a prosthetic lens and everything looks natural.